Welcome back to Inside City Hall. Budget negotiations are shifting into high gear up in Albany, and advocates are calling on Governor Hochul to increase funding for safety net hospitals around the state, which provide services and care to patients who lack insurance or rely on Medicaid. Safety net hospitals predominantly serve communities of color, which experience disproportionate rates of chronic illnesses and need a lot of help. The New York Safety Net Coalition is leading the fight and has made a number of recommendations, including increasing Medicaid reimbursement rates. We'll explain why. The group says that the funding is needed to help make the Medicaid reimbursement system more equitable, and it will help many hospitals maintain cost and maintain a level of service that we need. I'm joined now by a special panel to talk more about all of this. Lorraine Brown is the chair of the New York Safety Net Hospital Coalition and the CEO of One Brooklyn Health System. David Perlstein is the president and CEO of the St. Barnabas Hospital Health Systems up in the Bronx. Thank you both for being here. Very good to see you.
Thank you.
We spoke last year. It sounds like the same problem is back. By definition, safety net hospitals are helping patients regardless of whether they have the ability to pay or have any insurance. But Medicaid only reimburses, and this is the big federal program that makes all of this possible, they only reimburse 61 cents on the dollar. So they're asking you to take on indigent patients who don't have insurance and then saying, we know it's going to cost $1, here's 61 cents. How do they expect you to make up the difference?
Well, I think the issue, Errol, is even more unfair than what you just articulated, because they're asking us not only to serve patients without regard to their insurance, but they're asking us to do the very same things that other hospitals who have the opportunity with commercially insured patients to do. We have to commit to providing the same levels of care, the same quality. We have all the regulatory requirements that every other hospital has. And the Safety Net Hospital Coalition comprises hospitals that have 36% or more, and in many cases 60%, 50% of our patients who are insured by Medicaid. And less than 20% of our patients are insured through commercial payers. There are other hospitals who have larger numbers of patients who are commercially insured, and they're able to what's called cross-subsidize for the underfunding of Medicaid. And they are able to invest in their facilities, to create additional services, to support their workforce. And we're struggling with that.
Why do we have a policy of underfunding? I mean, you know, the money hunt tends to be, can we get it from commercial patients? Can we get it from Albany? Can we go out and have galas and fundraising balls and so forth? But why is that the way that we take care of so many millions, in our case, of New Yorkers?
Well, Errol, the fact is, and I think it has to be said, I think it's somewhat of a racist policy. These are usually old red line neighborhoods that have basically been allowed to really suffer for many, many years. And these are patients that primarily are poor, people of color who are living way below the poverty line and dependent on either state and federal programs to get health care. And I don't understand why we are not investing more in these programs. And the fact is that we haven't invested in these programs for so long that the impact has been really almost near collapse of the system. You know, you can't continue to just fund enough to allow us to deliver basic care and then have expectations that you're going to have different results.
Well, what has the situation been like at St. Barnabas? I mean, the money squeeze, and you figure out a way to make ends meet one way or another, but what does that stop you from doing? What does that mean for patient care or for your reinvestment in your basic system?
Thank you. It means we constantly have to make decisions about how we're going to spend money. It means we may not be able to create the respectful spaces that our patients deserve. It means I may not be able to fix elevators. I may not be able to purchase equipment that I need in order to deliver the technology and the technology care. I may have to think about what services I have to cut. It puts us in just a terrible position because the community requires certain services because it's their needs. And the fact is, behavioral health usually traditionally does not cover you're not covered by the cost by behavioral health services. We're really struggling to make sure that we have the right amount of staff. It's just terrifying because the fact is that we we have every year, we set a budget and we come in on our expense side. But every year, our revenue drops further and further because even though we're talking about this 36%, SBH at St. Barnabas, 95% of our patients are in part covered by some government program, and I would say up to 80 to 85% are in part Medicaid. The math just doesn't work.
Sure.
And the math doesn't work, and to your question, Errol, we make these choices. Sometimes we don't pay bills, right? We have vendors who have to wait. I mean, can you imagine having to develop a payment plan for the provision of medication, or to be able not to be able to buy medical equipment, or to have to rely on medical equipment that has essentially gone through its useful life? David mentions that, fixing elevators. Can you imagine when you have an emergency, something you've not anticipated, trying to figure out how to pay for it? But most importantly, we have a situation where we can't compete for staff. And we can't grow services. And so when we see a need in the community and we know what we need to do for it, we oftentimes can't start up that new program, or we have to choose amongst all of the needs that our communities have.
Last year, when you went to Albany to try and correct this problem, you asked for $1 billion. You got about 80% of that. You got about $800 million. I imagine there's a comparable need this year, and are we just kind of reliving this year after year, or is there any talk about a permanent, sustainable, renewable source of support for that?
So last year, as you mentioned, the governor put in $800 million for safety net hospitals, not just our coalition, but for all safety net hospitals. That was a one-time emergency funding, one time. This year, of course, you get one-time funding, we have to come back. This year, we're putting forward a proposal that would allow for there to be greater stability in terms of the funding for safety net hospitals. Again, not just our coalition, but all safety net hospitals within the state. We're putting a proposal that says that the Medicaid reimbursement should increase to what's called the average regional commercial rate. When we mention that there are hospitals who are able to have stable budgets, and they have more than 20% commercially insured, and they can cross-subsidize, many of those hospitals get rates for their commercial payers of 7 times what we get for the very same service. Very same service. So we're proposing, and we have legislation that we're putting forward as well. We're proposing that the Medicaid reimbursement for safety net hospitals basically be the average regional commercial rate. And moreover, we believe that it's a viable plan for the state because it brings more money from the federal government. The cost would not be solely borne by the state of New York. We've talked to federal officials who said they've used that methodology with other states in targeting certain classes of hospitals such as ours, to be able to recognize that there needs to be investment in the hospitals that serve communities like ours, and in fact, to address the inequitable healthcare delivery system.
Okay, yeah, we certainly remember, on this program at least, what happened and what you all did to bring us through the pandemic. So these are not academic issues, and these are not just confined to a handful of neighborhoods, but really important piece of the public health system. Right. We're going to continue to follow this. We'll wish you the best of luck as we all try to get through this budget season. Thank you very much tonight.
Thank you.
All right, that is going to do it for tonight's show. Thanks so much for watching, and have a great evening. We'll see you next time inside City Hall.